Hi, my name is Toby, and this is my friend Paige. Our presentation today is on peri-implantitis, primarily focused on prevention and treatment.
So Toby and I felt like peri-implantitis was a really important topic to discuss because of the rise in the number of implants being placed. Dental implants are becoming more and more popular among our fully and partially edentulous patients. With the rise in implants being placed, there's a growing concern for the possibility of these patients developing peri-implantitis. Worldwide, over 15 million implants are placed every year, and out of these 15 million people, 3 to 4 million will develop peri-implantitis. Peri-implantitis is an infection affecting the soft and hard tissues surrounding a dental implant. Properly caring for and maintaining good oral health is necessary for the success of dental implants. There are numerous non-surgical and surgical options for treating peri-implantitis. It is increasingly important that dental hygienists know and understand how to establish health within dental implants and their surrounding structures. Peri-implantitis is the inflammation of the gums at the site of a dental implant. Bone loss around the implant can lead to a decrease in support structure that is necessary for the implant to be successful. Peri-implantitis is usually associated with bleeding on probing, suppuration, increased probe depths, and mobility due to bone loss. With the increase of implants being placed, it is increasingly important that hygienists are educating our patients on how to properly care for and maintain these implants. It is imperative that patients establish an effective oral home care routine and that they have the support from dental staff to offer the recommended prophylactic procedures. Often when patients receive a dental implant, they don't have the best home care to begin with, and this is not something that we want to carry over into after they receive their implant. A lot of the times patients develop a post-surgical fear that they're going to harm their implant and they don't want to brush well around it, they don't want to floss well around it. On the flip side, sometimes patients know that they've paid good money for this implant and they want to do a really good job and take really good care of it. They can oftentimes become a little overzealous in caring for their dental implant, and it's our job as dental professionals to educate our patients and make them aware that overzealous cleaning also can cause irreversible damage like recession. There are several risk factors that can increase a patient's risk of developing peri-implantitis. A few of them include smoking, those who have a history of periodontitis, those who have untreated periodontitis, diabetes, those who are insufficient in their maintenance care, anybody who had a non-specialist place a prosthesis, patients who have excess cement or have a bone-level implant design. It should be noted that individuals who have properly treated periodontitis are at a no higher risk of developing peri-implantitis than those individuals who are non-periodontitis susceptible. Individuals with remaining periodontal pockets at the time that they receive the implant are 3 to 4 times more likely to develop peri-implantitis than those with previously successfully treated peri-implantitis.
Maintenance of peri-implantitis is based on the concept of removing bacteria and infection around the implant site. Goals include removal or control of the infection, preventing the progression of bone loss, as well as the bone regrowth or implant osseointegration. Treatments include a well-established home care regimen, a debridement from a hygienist, and reconstructive surgical procedures. Some non-surgical treatments are as follows, but not limited to chlorhexidine, the use of curettes, the use of ultrasonics, and air polishers. Chlorhexidine, even though it only has a small added effect, in a particular year-long study that we researched, it was shown to lessen bleeding upon probing 83% to 30%. Curettes, you want to use a curette that isn't hard, like titanium. You want to use one that is either plastic, carbon, or what's the other one? Teflon, I think. Air polishers and ultrasonics. Ultrasonic methods can lead to a 30 to 40% biofilm reduction, and the use of air polishing can go from a 40 or 30-ish% to a 46% reduction of biofilm. Surgical procedures consist of regenerative surgery, reconstructive surgery, as well as apically repositioned flap surgery, but it's not limited to just those. That's just to name a few. It can also include the removal of the implant itself, if necessary. Although non-surgical treatments are unpredictable in the healing of the infection, all non-surgical treatment is essential in the maintenance of peri-implantitis. However, no non-surgical approach is considered superior over the other. Non-surgical treatments can help in the restricted impact, or they can help on a mild peri-implantitis case, but they are restricted to helping the ones that are more intense or severe, leading to surgical procedures, usually following non-surgical treatment. Whether surgical or non-surgical treatment are used, in the process of dental or treating dental implants, the means to a successful implant will require the removal of biofilm and the infection around the implant itself.
So in conclusion, it's so important for dental professionals to be educated on the maintenance of implants and be diligent in our patient education. It is imperative that we utilize the surgical and non-surgical procedures that are available for us to care for dental implants, in hopes that we can achieve our end goal and establish health in all of our patients' implants.